Welcome to the Art of Therapy. I'm Dr. Warwick Phipps. Together with colleague clinical psychologist Marizaan Koen, join us as we explore not just what therapy is, but how to do it more effectively, helping you deepen your therapeutic skills and elevate your practice one conversation at a time.
Okay, so today we're back and looking at another episode of The Art of Therapy.
Yes.
Yes, yeah, so excited about that. And just to have a look at what we did on the last episode of, on the last podcast. So the last time we really had a look at the different definitions of relationships in a therapeutic context. So exploring a little bit around the social, the antisocial, and then the specific one that we had a look at is the asocial relationship. And what it is and what's the meaning of it in a therapeutic relationship. So I want to check with you. So from the last time that we started to have a look at it as a asocial relationship, is that a asocial relationship is really it's not social, it's not antisocial, but it's a therapeutic relationship, really in assisting in the therapists themselves, really creating a room for the client or the patient to become more and more visible, how they relate, how they engage, and to assist with that, so that the therapist has more knowledge about about the person that comes for therapy. So I wanted to check that with you and just what are some more thoughts about that?
Yes, I'm excited as well. This is such an important area that we're looking at, so that we're going into it in more depth, I think is key, because it's the fundamentals of psychotherapy and how to do this and how to be a more effective psychotherapist. So excited. So let's look at exactly what you've said. You've described it, I think, really effectively and well. The main aspect that we've been looking at is the definition of the relationship, and that an asocial relationship involves the client becoming increasingly visible in terms of their own needs. And the therapist, this is not an exchange of the therapist's needs. So it's not a social relationship, it's not against social, it's without social. And so that means the focus is entirely on the client and their well-being, their needs, their interests, their development. So that is a core focus. And then what we began to look at is where it's something that's another concept juxtaposed, that we started to look at the involvement or choice of being more directive and non-directive. And what does that involve? And the key understanding here is that being directive or indirective and the choices one makes as a therapist are always in the context of a relationship, a therapeutic relationship that's defined as asocial. So the choice of whether to be non-directive or directive, again, is in the best interest of the client. So we've got two separate concepts. One is the definition of relationship, and it is asocial. And the other then is a question of how directive or non-directive the therapist is within that context and what guides the therapist.
Okay. So it's breaking it more and more down and looking at more of the details around it. Yes.
We've promised to simplify things. So this is, yes, one of those that we're breaking down some of the details, the complexity, and making it more easy to understand and therefore implement and utilize.
Okay. So how about if we get into that? So if we maybe start to have a look at more of the directional approach and what it means, what it is, what it means, how to do it. And then what is the benefits around that?
Right.
And then the same for the non-directive approach and when to do it and how to do it.
Okay, I'm so glad you've looked at it in this way, because the two are always connected, they're relative. And there's no benefit to just directive, there's no absolute benefit or an absolute benefit to non-directive. As we often have said, nothing's right or wrong in psychotherapy. This is really about impact and effect and understanding when one comes in more directively and when one is more non-directive. But just if we just back up a little bit, as we touched on one of the earlier episodes, the idea about directive and non-directive really came from the person-centered approach, where Carl Rogers identified that in a relationship that's non-directive, where it's somewhat neutral, and where that therapeutic relationship with client and therapist is characterized as being one of very high empathy, accurate understanding, the congruence in the communication, and then the lack of judgment. When those aspects are present in the relationship, the thinking in person-centered therapy is that the client is able to understand themselves, can become more prominent, and can express themselves without any fear of judgment, and can self-actualize. So person-centered therapy is very much about creating a non-directive therapeutic relationship. But everything we do is directive. Everything has communication value. Everything has impact. But to the extent that one tries to minimize stronger impacts or impacts that are more directional in the therapy, and creating an environment where the client can become more visible through the process, that is more of a non-directive approach. It was Charl Vorster who really identified and utilized the analogy that a non-directive approach is something of dancing with a broom, and the therapist is the broom, and the client moves the broom in a particular direction. And that is something of a non-directive approach. So that a non-directive approach is key, as it is one that is more neutral and enables the client to become more visible, prominent. But we're going to come back to more of that. That is different to being more directive, and where the therapist indicates a particular direction for the conversation, a direction, clear and very evident direction for the therapy process or that session's process. And to the extent that the therapist is coming in more directively, and the client is going with that, that is a more directive approach. So those are the two ends. They're on a continuum, with one can put a non-directive, more neutral on the one end, and increasingly directive inputs and communication on the directive end.
Okay. So it's really two continuums, and there's a vast continuum of it. It's not just the one or the other. They are really on a continuum.
Very much. They're all part of one continuum, different ends, and what impact they will have different impacts in the therapeutic process.
And what will be then needed, and what will be in the best interest of the client.
So this is what you've identified is so important, because in therapy, it's a timing issue. And now we just look at the benefits of, or what is one trying to utilize, go for in a non-directive approach.
Okay.
In a non-directive approach, there are two major benefits. The first is that when a client is non-directive and facilitates this environment, a person-centered environment, it is for the most part immediately therapeutic for the client. Just have you had that experience of someone accurately listening to you and communicating that very congruently, very authentically, without any judgment? That just the experience of that.
It's that massive relief, and that in itself brings massive relief.
Indeed.
And is therapeutic.
Yes. It brings great relief. It's often an emotional corrective experience, just to be heard, understood without judgment, and how clarifying that is in a relationship about oneself and one's needs and who one is. It can be a remarkable experience. So that is almost invariably therapeutic in and of itself. We often think the therapist has to do a whole lot of things, but very often in the beginning, in establishing a therapeutic relationship, is staying out a little bit, being less directive, non-directive, and just really being present for the client, hearing them and being with them, journeying with them. So that's therapeutic, the therapeutic benefit. There is also something very profound about the non-directive approach when it comes to diagnosis.
Okay.
Because effectively what's happening in a non-directive relationship or interaction, the client is taking the lead, and they are moving that broom around. But how do they move that broom around? What pattern is occurring in the relationship, in the therapeutic relationship? And so very often what begins to happen in an environment with deep understanding, with very genuine, without judgment, someone can be more of themselves. But in becoming more of themselves and how they're relating, that gives us some idea as to how the client is relating with me in this very moment, how this could potentially relate to what they're having difficulty with. And so it has the non-directive approach or utilization has very, very key diagnostic benefits. We're not talking formal assessment or anything. We're just looking therapeutic assessment or therapeutic understanding of trying to formulate what the problem is. So that's where the non-directive approach comes in.
It's really a benefit on two sides. Like I said, the one side is the therapeutic and creating relief for the client. But on
Yes.
the other hand, also understanding them more and understanding how to actually help them in that context, without the frame of the therapist entering, but really just staying in the frame of the client. Then, actually, like you say, becoming the client just becomes more and more visible. But it actually creates a lot of clarity as well in how to assist further and how to support.
You've described it beautifully. That's exactly it. And we often think that therapy is what is happening, and what's important is outside of the therapy room. The client is talking about something that's happening in their relationships, in their family or primary system, or something that's happened. And that is the then and there, or the there and then, however you want to look at it. But in really, the core of psychotherapy is what is happening in our therapeutic relationship now. That is, because all changes now. So how are we relating within our roles as therapist, client? What's happening right now? And if we can understand something of this and connect that with their presenting problem or difficulty, then we can assist them in making changes in the here and now, so that once they have a corrective and are able to relate in new ways, more helpful ways, they can begin to implement that, generalize that in their relationships and interactions beyond the therapeutic relationship.
Yeah, that's beautiful. It's all happening in the here and now. Even when we as therapists deal with things that happened in the there and then, all the changes, like you said, is in the here and now, and assisting clients in that frame of reference.
Very much. It's and hopefully we can come back to that because it's just so central. What I also would want to note is, again, nothing is wrong or right. As we know, it's just what impact. So a non-directive approach has its place in terms of the immediate therapeutic relief, often in the early phase of therapy, the first session or two, and then the diagnostic benefits. And that is helpful then. And a more directive approach, again, is going to be indicated when a client is seeking more direction and needs guidance, needs input, and needs trusted professional input. Of course, they can go to a friend, they can go to a colleague, but the context of that is that it's not necessarily trained knowledge. It's not necessarily knowledge that's of expertise, that's been found to be tested knowledge. And very often in any feedback in a social relationship, is that feedback is it in relation to the other person's needs because it's social, or is it for that particular person? So there is a need for increasingly directive inputs. But the beauty in therapy is being able to determine, given the client's best interests, when to come in more non-directively, when to come in directively, as to mobilize that client. And it's certainly when a directive input is given, then after that, it's back to non-directive and just seeing where the client is at. Has there been a change, and reviewing from there in the here and now.
In the here now. Yeah, that's beautiful. And like we said in one of the previous ones, it's all about timing. There's a place for both of them. But it's the more we understand the directive and the non-directive, and looking at timing and what will the impact be on the client, the more we can very consciously start to utilize that and bring about that impact that we actually want. So I'm excited to go into more depth. I'm already starting to wonder about all of the other details that we can go into this. So
Yes.
I think this is very very meaningful, and looking at this and being able to explore this even further and further.
I share that it's all about understanding. And once you can understand more and more about psychotherapy, you can start having the desired impact and effect as a therapist, and watch the client become increasingly mobilized, which is a very profound thing to see.
It's one of the goals of being a psychotherapist, and why people come for psychotherapy.
Yes, that's what it's all about.